i-inaugurate ni Pangulong Ferdinand Marcos Jr. Isa sa ospital dun sa Taguig, ang Healthway Cancer Care Hospital sa Taguig City. So ngayon bumababa na siya. Kanina nga medyo nagkaroon tayo ng problema sa ating pagbibideo. So ito siya, papasok na siya. I-inaugurate niya yung hospital, guys. So ito na po siya.
Ladies and gentlemen, the President of the Republic of the Philippines, His Excellency Ferdinand R. Marcos Jr.
So guys, ito, courtesy ito ng RTVM. Ibig sabihin, RTV Malacanang. Pag-aari po ito ng gobyerno ng Pilipinas. So, isa itong bagong ospital at sa pangunguna ng again guys, ito ay courtesy ng RTV Malacanang. Pag-aari po ito ng gobyerno. So, ipatutuhay ko sa inyo ang inauguration speech ng ating Pangulong Bongbong Marcos Jr. Pakinggan po natin.
To begin our program, may we call on the President and Chief Executive Officer of AC Health, Mr. Paolo Borromeo, to give his welcome remarks.
Maganda itong hospital na to para sa mga cancer patient.
Thank you. To His Excellency, President Ferdinand Marcos Jr., and to all of our distinguished guests who have joined us today, good morning. It's my honor to welcome you to the inauguration of the Healthway Cancer Care Hospital. This day culminates years of relentless dedication from countless individuals, physicians, partners, and patients who poured their hearts out into making this hospital a reality. As we stand together to inaugurate this facility, I am filled with immense pride and gratitude. Mr. President, in our very first PSAC health meeting, you encouraged us, the private sector, to work in partnership with your administration, the DOH, and our local governments to uplift healthcare, including building more specialty centers around the country. This Healthway Cancer Care Hospital is our response to your call, a testament to the unprecedented level of collaboration among all stakeholders to improve cancer care for all Filipinos. When we first embarked on this journey a few years back, not only did we recognize the gravity of cancer as a public health concern, but we were also keenly aware of the many gaps in the delivery of cancer care. We saw that over 100,000 cases a year were diagnosed, and we estimated that at least another 100,000 cases were undiagnosed. Of those that were diagnosed, many were diagnosed late stage, many left untreated due to the hopelessness and the massive financial burden. We built this hospital to help address these pressing challenges. Our goal is to be the leading private cancer care institution, providing world-class treatment but at lower cost, so that we can extend the best value private cancer treatment to a broader base of Filipinos. Every aspect of this establishment has been meticulously designed and precisely planned with the Filipino cancer patient in mind. Located in the thriving area of Arca South here in the city of Taguig, we have strategically positioned ourselves at a central point in Metro Manila, easily accessible from the south, the east, the north, and to Filipinos nationwide because we're just 20 minutes away from the airport. We took best practices from all over the world and localized it to the Philippine context. And this hospital is designed to accommodate the diverse needs of Filipino patients. It will feature a complete range of services, including top-of-the-line diagnostics and radiation equipment, comprehensive outpatient and chemo facilities, inpatient and palliative services, catering to different needs. Moreover, the Healthway Cancer Care Hospital is the central point for oncology in our integrated Healthway medical network and the broader AC Health ecosystem. With our network of 5 hospitals, 16 outpatient centers, and over 200 corporate clinics, coupled with the extended reach of our Consulta MD telehealth platform with over 3.5 million subscribers, we're able to expand the reach of our cancer services so that we can screen more, so that we can detect earlier, and so that we can treat better. Through our pharma group, which includes our 750-store Generica drugstore chain and our pharmaceutical importation business, i.e. Medica and MedEthics, we are able to provide more affordable medicines and treatment options to cancer patients by bringing in high-quality biosimilars and generics. With our entire network at AC Health, this will allow us to offer a uniquely differentiated experience for Filipinos and allow us to provide more affordable, accessible cancer treatment. But what truly sets the Healthway Cancer Care Hospital apart are all the partnerships that allow us to provide high-quality care. As you saw last week in San Francisco, Mr. President, our partners at Siemens, Varian, and Cancer Treatment Services International provide us world-class expertise in cancer hospital services, in diagnostics, and in radiation treatment that will differentiate the patient experience in this facility. We've also partnered with leading global drug manufacturers such as Roche, MSD, AstraZeneca to implement patient access programs, making it easier for our patients to avail of the latest cancer therapies and innovative medicines at more affordable rates. We're also privileged to have partnered with IFC for a $100 million 10-year social bond, the first of its kind for healthcare in this country. IFC has guided us with international best practices and global standards, including making this hospital the first EDGE-certified green hospital in the Philippines. Lastly, and most importantly, I would be remiss not to call out our partnership with the public sector. We are extremely grateful for all of our government partners who are here with us today. Our experience battling COVID together showed us that a whole of society approach is needed to improve healthcare for all Filipinos. Mr. President, we intend to build on this momentum with our work at PSAC Health and in close collaboration with your administration, the Department of Health, and all of our local government counterparts in our fight against cancer. I always say, together, we conquered COVID. Now we conquer cancer. In closing, I extend my deepest gratitude to everyone who contributed to this endeavor, all of our valued partners, our extremely dedicated team members, and healthcare professionals, without whom we would not be here today. To all of us, cancer is a deeply personal experience. We've all lost family members or friends to cancer. And what unites all of us in our team is our common goal to preserve lives and our common goal to help patients and families go through the healing process. This is what has inspired all of us every step of the way. Today, we stand in solidarity with our patients, and we dedicate this institution to their bravery, resilience, and unwavering spirit. This hospital will serve as a beacon of hope, a place of healing, of comfort and compassionate care for every Filipino battling cancer. With that, please allow me the pleasure of introducing our biggest champion for AC Health and our AC Health chairman, Mr. Fernando Zobel de Ayala.
His Excellency, President Ferdinand Marcos Jr., and our esteemed guests, good morning to everyone. Today we gather not only to celebrate the opening of the country's first specialized cancer hospital, but also to commemorate the perseverance, creativity, partnership, and dedication that have culminated in this important facility. At Ayala, we have always believed in the transformative power of business as a catalyst for positive change, collaborating closely with the government to address societal gaps and build a stronger nation. Our journey in establishing this hospital underscores this belief. Witnessing the growing cancer burden in the Philippines, we recognize the urgent need to augment the government's efforts in providing comprehensive and accessible cancer care. Mr. President, this hospital stands as a tangible manifestation of our collective resolve, a result of tireless dedication, not only within Ayala and AC Health, but also from fruitful collaborations with the public sector and other key stakeholders. We extend our deepest gratitude to all those who have supported us in these efforts. Your administration, Mr. President, DOH, FDA, PhilHealth, DOST, PNRI, FTI, DILG, and the LGUs of Taguig and Parañaque, among many others. Without your shared commitment towards making a meaningful impact in the lives of those battling cancer, all this would not have been possible. I would also like to acknowledge and express our sincerest thanks to our founding physicians and medical advisory board, whose visionary mindset and collective expertise have served as a guiding light throughout this whole endeavor. The Healthway Cancer Care Hospital is truly privileged to have a team of some of the nation's finest cancer specialists, and it is an honor to collaborate with these dedicated doctors to redefine cancer care. Let me also recognize all our teams, including architect Danley Chauco, allied medical professionals, and staff at Healthway and AC Health, who have worked diligently and selflessly behind the scenes to bring this vision to fruition. It is truly remarkable how the practice of healthcare brings together the most brilliant and motivated people from a broad spectrum, who are united and driven by this opportunity to make a profound difference in people's lives. We take immense pride in having such a dedicated and diverse team supporting us in this noble mission. Lastly, I would like to express my heartfelt appreciation to those who will always be at the heart of the Healthway Cancer Care Hospital, our brave and inspiring patients. Your unrelenting strength and invaluable insights and your deep understanding of the issues we seek to address continuously drive us to do better. Your feedback and involvement shaping our approach to building this facility and its programs. We are grateful for your trust and partnership as we hope to ensure that this hospital, which we dedicate to you, will be one that is truly patient-centered, empathetic, and responsive to your needs. To close, the Healthway Cancer Care Hospital is a testament to our shared purpose, a purpose centered around the well-being of Filipino cancer patients and their families. It is a sanctuary where lives will be touched, hope restored, and healing found. Today marks not only the inauguration of a physical structure, but also the beginning of a journey towards revolutionizing cancer care in our country. On behalf of Ayala, we are honored to be part of this endeavor and remain committed to working hand in hand with the government, key partners, healthcare practitioners, and patients to elevate cancer care and Philippine healthcare as a whole to a standard that every Filipino deserves. Thank you very much.
Thank you, Mr. Fernando Zobel de Ayala.
Ayala pa lang ano.
May we invite everyone to
Partner
please
nila,
focus your
gobyerno.
attention on screen for an audio-visual presentation on the Healthway Cancer Care
Tingnan natin kung
Hospital.
anong mga serbisyo nila dyan sa Healthway Cancer Care.
Ang nanay ko po napakamasayahin. No? Laging nakangiti, kahit may problema. Nalaman namin na stage 3 cancer na siya. Kita namin siyang nagsusuka, pumipila kami ng mahaba sa ospital para lang po mapacheck up siya. Naranasan po namin lahat para lang po masurvive yung nanay ko. Kahit kaya mong gumawa ng paraan na may gamot naman, kaso yung magulang mo na yung sumusuko. Kung pwede mo lang akuin yung nararamdaman niya. Kung pwede lang ibalik yung buhay ng nanay ko, gagawin ko po talaga lahat.
Courtesy po ito ng RMTV.
Sometimes people forget the most
RTB
important aspect is
Malacanang.
the patient. Healthway never forgot. Beginning, when research was done, they consulted patients every step of the way. You know, you heal best when you're in a place where you feel most loved or cared for. Patients were a big part in the shaping of Healthway. That's what gives the hospital heart and soul.
Well, I think it's everybody's dream to have a specialty hospital whose services are really centered into cancer. You know, we had to identify physician leaders whose interest is really in subspecialty cancer care. And it really is collaborative. It has to be really comprehensive and multidisciplinary. So we've organized ourselves to deal with specific cancer types. The best models of these are our centers of excellence. We've developed 4 centers of excellence at the moment. Breast cancer, colorectal cancer, head and neck cancer, and lung cancer.
So one of the biggest benefits about the Center of Excellence is that we will screen patients. And if we detect the cancer on their mammogram and ultrasound, they can proceed to biopsy all in the center in one day. So this is a big factor. It saves time. It saves, days of waiting, anxiety.
We've taken every effort to ensure that we offer end-to-end services to make the journey easier for patients and for their families.
I'm really very happy and proud to be a part of this family who will be managing, caring, showing compassion, expertise in one hospital.
One of the things that is very important for us in terms of the design was making it sure that for the patient. Number one, if we wanted natural light to permeate through the second one would be to make it as efficient as possible for the staff. Patient privacy was also important for us. Particularly proud of our quad 4-bed ward. What we were able to do was create a level of privacy for patients in these charity wards.
Our mission is to help create a world without fear of cancer. We have reached across our vast network of both leaders in technology and operation of cancer centers and have brought the best practice to the hospital to be used.
It's been a very long-standing partner of IFC going back decades. And they had this really interesting project, and one of IFC's priorities in the country is to close those gaps in the healthcare sector. And this is why we decided to partner with IRA Health.
All of these partnerships that we've developed with local as well as global entities are designed to actually enable us to deliver the best cancer treatment services to all of the patients that we intend to serve in the Philippines.
Our goal is to redefine the landscape of cancer care here in the Philippines.
To us, this is our legacy, that we're able to provide affordable treatment to our fellow Filipinos who are going through cancer.
What
What truly excites me is the opportunity for this hospital to establish a profound legacy, enhancing not only the quality of cancer care, but also its accessibility. What could be more gratifying than contributing to the mission of saving lives?
Father ko, my two brothers and two sisters had cancer. Sa experience ko sa aming pamilya, importante pala na hindi lang cancer patient ang inaalagaan, pati ang pamilya. Kaya nung binubuo namin itong ospital na to, nakafocus kami not only on the cancer patients, but also on their families. Being part of this cancer hospital said giving me the opportunity to make a difference, creating a positive impact on the lives of people, especially those with cancer.
Healthway Cancer Care Hospital. Beyond cancer, towards wellness.
Yan guys. Ating komento na ng saglit. So ito nga po yung Healthway Cancer Care Center or Hospital dito sa Taguig City. So ito po ay pinagawa ng mga Ayala in partnership with the government di umano, yun nga para sa mahihirap din di umano. So affordable ang sabi niya dito. At tingnan natin kung magkakaroon to ng malasakit center para sa mga mahihirap nating mga kababayang Pilipino dito sa Pilipinas. So ituloy po natin. Ito po ay delayed telecast at ito po yung nangyari lang kani-kanina lamang. So ituloy po natin.
At this juncture, may we request the President, assisted by the stage party, to lead the unveiling of the marker of the Healthway Cancer Care Hospital.
Si Ferdinand Marcos Jr. po ang nag-inaugurate ng hospital na to. Alamin natin kung saan banda to.
At the count of 3, Mr. President. 2, 3. Ladies and gentlemen, a round of applause, please. Thank you, Mr. President. You may now be seated. May we invite Secretary Teodora Herbosa of the Department of Health to introduce our guest of honor.
Ladies and gentlemen, the President of the Republic of the Philippines, His Excellency Ferdinand R. Marcos Jr.
Thank you very much. Please take it. Thank you very much to our Health Secretary, Derbosa, for his introduction. The members of the Diplomatic Corps, the visiting ministers we have here with us from the United Arab Emirates, Interior and Local Government Secretary Ben-Hur Abalos, the host city to this rather impressive facility, Taguig City Mayor Maria Lainey Lopez Cayetano, other elected officials that are here as well. Of course, the proponent for all of this that we are opening, inaugurating, and bringing to the service of the people, Ayala Corporation Health Chairman Fernando Suda de Ayala, Ayala Corporation Health President and CEO Paulo Borromeo, who malapit na magkakaroon ng opisina siya sa Palasyo. I see him more often than some of our other cabinet secretaries. wala talaga, yun ang ano niya, that's his advocacy. And you can see that, when he's bringing something to the table, he means it. It's not just business, it's not just, he means it. It's important to him, and that is why we have encouraged him and try to support everything that we have been doing from the government side, because it is clearly all very important. So the other distinguished guests, ladies and gentlemen, good morning. I am extremely pleased to join you today as we open this first hospital in the Philippines dedicated to cancer care. Hospital. I have to thank Healthcare Holdings Inc. And its chairperson Fernando Ayala for this noble achievement. Let me also recognize the city government of Taguig, the Department of Health, the FDA, for their efforts in accelerating the process to establish this facility. The opening of the HCCH will go a long way in improving access to quality cancer care for many Filipinos. Moreover, this endeavor highlights our strong partnership with the private sector in strengthening our healthcare system, which is aligned with the Philippine Health Facility Development Plan and the Integrated Cancer Program. All of this is geared towards our goal of universal healthcare. With the help of HCCH, we can revolutionize the cancer care service industry in the Philippines through modern, state-of-the-art equipment, coupled with leading medical professionals and oncologists. It will certainly positively reflect on the country's growing potential as a leading healthcare destination in Asia. Cancer still remains as one of the most dreaded illnesses in the country. Secretary Ted Herbosa just informs me that the cancer is now number 3 in terms of mortality for our general populace. However, with facilities such as this, we will allow the main weapon that we have in combating cancer, early detection. Early detection, this allows us for patients the best chance in fighting this disease. We therefore encourage all Filipinos to get regular checkups now that we have the facilities by going to community health centers. We have also made available primary care services where patients may consult for early detection of cancer. Our PhilHealth Consulta primary care team is also available to provide free diagnostic examinations and laboratory tests. For cancer treatment, we have designated 25 specialty centers in cancer care in select DOH hospitals nationwide. So I encourage the public to maximize these programs, services, and facilities for cancer care, prevention, and treatment as the government strives to bring healthcare closer to the people. We recognize that there are great financial burdens to cancer treatments. So to ease the hardship of cancer patients and provide equitable access to
I-rewind nga
healthcare,
natin kung pre yung diagnosis daw. Laboratory.
Revolutionize the cancer care service industry in the Philippines through modern, state-of-the-art equipment, coupled with leading medical professionals and oncologists. It will certainly positively reflect on the country's growing potential as a leading healthcare destination in Asia. Cancer still remains as one of the most dreaded illnesses in the country. Secretary Ted Herbosa just informs me that the cancer is now number 3 in terms of mortality for our general populace. However, with facilities such as this, we will allow the main weapon that we have in combating cancer, early detection. Early detection, this allows us for patients the best chance in fighting this disease. We therefore encourage all Filipinos to get regular checkups now that we have the facilities by going to community health centers. We have also made available primary care services where patients may consult for early detection of cancer. Our PhilHealth Consulta primary care team is also available to provide free diagnostic examinations and laboratory tests.
Ayun.
For cancer treatment, we have
Narinig niyo guys? Pre-diagnostic test. So meaning to say, ang PhilHealth magbibigay ng pre-diagnostic test para sa mga cancer patient. Maliwanag po yon, ha? So, kaya lang sa community health center, hindi dito sa hospital na to. Ewan ko. Aalamin po natin yan. Tuloy po natin.
25 specialty centers in cancer care in select DOH hospitals nationwide. So I encourage the public to maximize these programs, services, and facilities for cancer care, prevention, and treatment as the government strives to bring healthcare closer to the people. We recognize that there are great financial burdens to cancer treatments. So to ease the hardship of cancer patients and provide equitable access to healthcare, we have also established the Cancer Assistance Fund, which will pay for the cost of cancer diagnostics and laboratories not covered by PhilHealth. So as we establish a more accessible, efficient, and responsive healthcare system, I urge all public and private stakeholders to support the Philippine Health Facility Development Plan. And so to ease the hardship of cancer patients and provide equitable access to healthcare, we have also established the Cancer Assistance Fund, which will pay for the cost of cancer diagnostics and laboratories not covered by PhilHealth.
Assistance Fund.
So as we establish a more accessible, efficient, and responsive healthcare system, I urge all public and private stakeholders to support the Philippine Health Facility Development Plan and invest in building more health facilities similar to the HCCH. Rest assured that the government remains committed to nurturing an environment that upholds the total well-being of our people, of course, with the continued support of our private partners and investors in healthcare. I believe that this is also, not only is this an important day in terms of healthcare and in terms of our capabilities and capacities to help cancer patients and to also those who need early detection, those who need testing, to give that facility to them. And it is important because we never had anything like this before. And it is a testament to the forward thinking of many of our healthcare professionals, and both in the public sector and in the private sector, certainly. And it is very important. It shows that we put a priority on the healthcare of our people. I cannot forget very early on in my political career when I was reminded. I was governor then, and and my staff could not understand. It says you're using up 1/3 of your provincial budget for healthcare. That is, we've never seen that before. And I quoted to them. I said, no matter how wealthy you are, no matter how successful you are, you cannot enjoy that wealth or that success if you do not have your health. And that is why it is a priority. It may not be politically saleable. And lagi kong sinasabi ko, pagka-eleksyon, sinasabi mo, tignan mo yung ginawa kong eskwelahan, tignan mo yung ginawa kong kalsada. What do you say about healthcare? Oh, our people are healthy. And that's why people tend to deprioritize it because of political concerns. But nonetheless, I cannot remove that from my mind. And I was told, I was advised, healthcare is important simply because nothing else matters if you are ill. Nothing else matters if you are sick. Nothing else matters if you are dying. And that is why I am so pleased. I am so happy to be here today to see this as we progress in our healthcare system for the Philippines. We have learned many difficult, tragic lessons from COVID. And I am glad to see that we are applying those lessons learned now to the healthcare of our people. This is also important because it is a very clear example of how the whole of society, whole of nation principle can bring success. We in government provide the atmosphere, the environment to allow, to encourage, even to promote these kind of projects, and we have come together, and we have come to this point, to this day, where we are able to say we now have a state-of-the-art cancer care center, which we have never had before. And I hope that this will serve as an example to many others who will say that this can be done, and to encourage them to do more. So let us work hand in hand as we take the challenges in public health and deliver quality medical services to our people all over the country. With all of us striving together in this pursuit, I am confident that we will succeed to bring forth a stronger and healthier Philippines in the future. Thank you. And I wish the men and women of the Healthway Cancer Care Hospital all the best and all the success. Mabuhay kayong lahat. Mabuhay ang bagong Pilipinas. Magandang umaga po.
Opo. So, natapos na
Thank
yung
you,
kanyang
Mr.
speech.
President.
Post po na
And now,
natin.
may we invite the
Ayun. So, yun. Ito po ang Healthway, Healthway Cancer Care na itinatag ng mga Ayala, at dito po yan sa Taguig City. So, sinasabi ng ating Presidente Marcos na ito po ay assisted ng PhilHealth, at meron pa siyang sinasabing assistance fund para doon sa mga hindi kaya ng PhilHealth. So, may assistance fund kasi malaking pera po yan pagka may cancer eh. So, kailangan nating alagaan ang ating mga sarili para hindi po tayo magka-cancer. Para hindi na tayo humingi ng tulong sa gobyerno. Pero kung nariyan na, nariyan naman ang ating private partners, public-private partners. So, gobyerno to at saka mga pribadong institusyon. Tulungan ng gobyerno at ang mga pribadong institusyon. Kagaya nitong Healthway Cancer Care sa Taguig City. So, hindi natin alam kung saan exact location ito, pero i-search natin yan. Para naman sa ganun, sa kaalaman ng ating mga kababayang Pilipino. So, yun. Nag-speech siya na maganda nga ito. Miski naman, kahit sino naman. Maganda yung inaalagaan natin ang ating mga sarili. Kasi kung tayo magkakasakit, kahit anong dami ng pera natin, gaya ng sabi niya, ni Pangulong Marcos Jr., na wala rin ang pera. Sana naman pumukol sa puso niya yan. So, eto, ituloy natin kung mayroon pang mga magsasalita. Eto pati guys, meron siyang ward, kumbaga, pang-publikong ward na di umano parang 4 yung sinabi nila, 4 na kwarto. Pero tingnan natin.
President to tour the facilities of the Healthway Cancer Care Hospital.
Guys, ito po ay courtesy ng RTV Malacanang. So, meaning to say, ito po ay pag-aari ng gobyerno.
May we request everyone to please remain seated as the hospital tour commences. Once again, may we request everyone to please remain seated as the hospital tour commences.
Ayan, nagtutour na ang ating Pangulong Marcos Jr. sa hospital na to. Sinecheck niya kung ano struktura ng loob ng hospital. So again, ito po ng RTV Malacanang. Itong RTV Malacanang ay pag-aari ng gobyerno at kaya ito meron ganito, tax din ng taong bayan ang ginagastos dito pagka-cover nito. So hopefully guys, magkaroon naman sana ito ng malasakit center. Kasi hindi kakayanin ng PhilHealth ang mga gastusin. Kailangan ito ng malasakit center. It includes PCSO, Department of Health, at iba pang ahensya ng gobyerno na nakapaloob dito sa malasakit center. Kasi kung ang mga institusyon ito ay magtutulong-tulong, ay kahit gaano kalaki yung gastos natin sa pagpapagamot natin sa hospital, ay gagaan kung tulong-tulong. Parang walis tingting yan. Magsubukan magwalis ng isang pirasong tingting. Di ba? Mahirap. Magdalawin mo yan, mahirap pa rin. Pero kung isang bungkos na tumutulong sa taong bayan, sa mamamayang Pilipino dito sa Pilipinas, magaang po. Magaang nilang matutulungan ang mga salat sa kayamanan. Halos isang kahig santokang mamamayang Pilipino dito sa Pilipinas. Marami po yan. Kung di ako nagkakamali, ayon sa statistics, ang mahihirap na mamamayang Pilipino dito sa Pilipinas ay 90%. Ang mayayaman, 10% lang. So, imagine niyo. So, 110 million Filipinos dito sa Pilipinas ay 90 plus million ang mahihirap. Mga 10 millions lang ang walang problema sa pera. Ngayon pa man, nagpapasalamat tayo sa mga Ayala at sila'y nakikipag-partner sa gobyerno para nang sa ganun. Yung mga cancer patient natin, yung mga kapwa natin Pilipino ay maibsan o magamot dito sa cancer hospital nito. Maganda. Meron tayong Philippine Heart Center, meron tayong Lung Center, meron tayong Kidney Center, meron na tayong cancer hospital. At ang inaantay ko po yung eye center. Wala pa po yung eye center para sa mga mata lang. Kasi sa lahat ng bagay ng mga hospital na yan, napaka-importante po ng mata. Alam natin yan guys. So yun ang aabangan natin. Hopefully in the future, magkaroon ng eye center para sa mga mata. Na mata lang kanilang specialty nila at yung hospital na yun ay mata lang ang kanilang titignan. Kasi imagine niyo guys, pagka ang mata ang lumabo sa ating katawan, parte ng ating katawan, damay na lahat, di po ba? Subukan yung pumikit kayo at maglakad kayo, di po ba? Wala kayong magagawa. Subukan nyo, halimbawa malabo ang mata nyo, hindi kayo nagsalamin. Di ba ang hirap po? Parang kakapakapasa yun. Ang hirap po. So yun po ang aking inaantay at inaasahan sa gobyerno ito. At naway magkaroon tayo ng Philippine Eye Center. Yung para sa mata lang. Para sa mga sakit sa mata. Hopefully mangyari yun. Habang binibisita ng ating Pangulong Bongbong Marcos Jr. ang hospital, magkomento tayo ng konti. Napakaganda naman itong hospital ng mga cancer or healthway Cancer Center sa Taguig City. So, yun nga po, ulit-ulit kong, kasi yun nga po, naranasan ko na malabo po ang mata ko at may low vision tayo. Sana naman, wag nang maranasan to ng ating mga kapwa Pilipino yung naranasan kong malabo ang mata at wala na raw lunas, sabi ng mga authorities. Pero ako'y umaasa pa rin na magkakaroon ng hospital para lang sa mga mata. Yun po ang importante sa lahat. Yun ka natin, kaya pag-ingatan nyo po yung inyong mga mata dahil ang hirap po magka-problema sa mata. So, wala pang pag-aaral tungkol sa low vision. Sinearch ko na ito, nag-research na ako tungkol sa low vision, pero wala silang lunas para doon. So, sa low vision, pinapunta pa ako ng sinasabi nilang low vision doctor at wala rin. Hindi rin naman po pwede operasyon. So, kailangan natin ng mga doktor na nag-aaral para sa mga mata natin. At kailangan natin ang prevention. Kung meron lang sanang maitatag ang gobyernong ito para doon sa mga may problema sa mata, magkaroon sana ng ospital. Panawagan po kung sakali mang merong staff o sino man sa Malacanang o mga staff ng ating Pangulong Marcos, talagang sasaludo ako, tuluhod pa ako sa inyo pag nagkaroon ng hospital ng mga mata. Meron diyang hospital ng mga mata, pero hindi po siya hindi po siya public. Private-public partnership. Ito po pribado. Sana magkaroon ng public. Ayan po guys. So, natunghayan nyo na yung patungkol dito sa video to. At maraming salamat po sa inyong panonood ng aking munting YouTube channel. At sa mulit-muli sa aking pagbablog. So, ito po ang inyong lingkod, si DIY KKB Informative. Keep safe, God bless, and you have a great day. See you on my next vlog. Thank you po sa mga subscriber ko at mga viewers ko. Thank you. Maraming salamat sa mamamayang Pilipino dito sa bansang Pilipinas.